So this is going to be a quick overview of the Bed Tracker software. It started really as a bed management system, but now it's more of a facility management system. I'm just going to preface this that it will connect to any EMR system, PCC. So a lot of the information that's in here, you won't have to manually input, and it will just be here from PCC. It will pull all the information from it. There will be some manual input, but we try to limit that as much as possible. So without further ado, I'm just going to get into it. So this is the dashboard. This facility has 227 beds. It has 190 beds that are occupied. It gives you an 84% occupancy rate. Currently, there's four beds available, 9 beds that need to get cleaned, 9 that are reserved for new admissions coming in, and 7 bed holds for people that are out in the hospital. Over here has some insurance information on the dashboard. It will tell you how many Medicares you have left. That has less than 30 days left. So you see John Kerry 102B has 28 days left. This is how many Medicares are left at less than 60 days. This is Medicaid, HMOs, private pays, non-payers, and this will be people that were rehospitalized within 30 days of coming to your facility. Next, we're going to go to the floor management system. So this is essentially a digital bed board. We scan your facility, your blueprints, your floor plan, and we digitize it. We make it that just making room changes a lot easier if you have new admissions coming in, or if you have people that have issues with each other, whether there's a reportable event, or someone that needs to be close to the nurse's station, or someone just doesn't like their room. This makes it easy to do the room changes without having to, those meetings sometimes take long because you're trying to figure out, do you have a room that's available, do you not? You'll be able to see here if you have any rooms that are down, any rooms that need maintenance, any rooms that are available, where they are, who they're next to. You can hover right over the patients that are in the rooms. You can see who they are. Right here, Hillary Clinton, you have John Kerry, you have George W. Bush. You can click on it also, or Giuliani, and it will, you'll be able to manage the bed from here as well. If you have multiple floors, you'll be able to just scroll through your floors. You have 5 floors, 10 floors, wings. You're really able to do all of that from here. Also, in bed management, if it's whatever room number they are in PCC, it will automatically be here. So you won't have to manually input anybody into this. It will always be correct if it's correct in PCC. We're going to move on to the bed management. When we go here, we have, let's say, patient name, we have the room number, we have the different statuses of the rooms, we have their age, we have the patient's email, their emergency contact email. This will help with grievance forms as well as admission packets or anything really that you need the emergency contact to sign will go automatically to them. This is their admission date. This is their gender, the type of patient, their general isolation. This is their medical condition. If they have any tube feedings, catheters, oxygen wounds, antibiotics, psych, diabetics, bed rails. You'll be able to pull a report to see how many people in your facility have these things from the system. This is where the insurance is. So you have primary, secondary. These people have, we just put them as Medicare and then Medicaid, but they give you just a list of different insurances. When the patient has Medicare, this will be clicked automatically, and it will tell you, let's say the patient has 51 days left. This will start a clicker. So the next day, it will go down to 50, 49, 48, 47 as they're getting their care. And then you can set up a notification, hey, notify me when someone has 20 days left. So we could work on either discharging the patient or figure out our next steps if they don't have secondary insurance, if they don't plan on staying at the facility. Here you have the rental equipment. So if the patient's on any equipment, specialty equipment, so it could be CPAP, wound vac, air mattress, you have other here, so you could type whatever equipment you want to save in there. When you check it off, it will ask you if it's rented or owned. This will help when a patient gets discharged, and I'll show you this in a second, will automatically get emailed to your vendor to come pick up. Hillary Clinton room 101, bed B, her air mattress needs to get picked up. Also over here, which I'll show you later, is the grievance forms that we have. But let's move into the census report. So this is essentially supposed to replace the end of day email that most facilities have. The admissions director sends out an email letting you know how many beds you have, what your occupancy is, your available, how many admissions you had, discharges, if you had any AMAs, and what your occupancy rate is. Here we have the pending referrals. So this will be added by the admissions director when she gets a referral from the hospital. I'll show you how to use that. So we'll have add a referral. We'll put the patient's name. Joe H. It's a Medicare. We'll ask you for the insurance number. We'll put that in, and we'll save the referral. So now that, let's say right here, you see Joe H. Medicaid, 7/8/25 at 12:31 p.m. Now let's say that person decides they want to come to our facility. So we just hit the plus sign right here, and it will give you a list of room numbers that are available to put the patient in. You can just click it, and then the patient will be inputted into that room. Down. So down here we have the planned discharges. This is really used for social worker when she has people that are discharging from the facility. Instead of the calendar that most facilities have, either a Google Calendar or something like that, she could just put the patient in right here. So we could pick a patient that's in our system, that's in your facility already. So Michael Brown gives you the room number. It gives you the discharge date, so we can choose whichever date we want. Say discharge, let's say the 22nd. It will give you a couple of reasons. You'll also be able to add in your own reason if you want to, but we'll just select insurance cut. We'll save the discharge. And now we have Michael Brown. He is being discharged on July 22nd, 2025. And the reason was insurance cut. And you'll be able to go, a month or however far in the future you want to go. This way you know who's discharging from your facility, and it makes it easier to be able to manage your census at the facility. Then we're actually going to go now. So when you go to manage bed, we saw that, let's say Hillary Clinton had an air mattress, and let's say she gets placed on a bed hold. That means in New Jersey, there's a requirement for a bed hold. We have to have the patient or the emergency contact sign something, and we also have to send that to the ombudsman once a month of how many bed holds we have in the facility. So here, we'll just select the hospital, St. Joseph's. It's going to email her for the e-sign that she received the bed hold. Once that is once that's sent, we will save the changes. And now we're going to go to notifications, and we're going to go to rental returns, and we're going to see Hillary Clinton on today's date had an air mattress, and it will automatically send your vendor an email to come pick up their mattress from room 101A. This way, you have nothing left in your facility. I just want to say it doesn't make a difference if you have more than one piece of equipment that's rented out for that patient. Whoever your vendor in our system is, so you'll be able to select the vendor. Whoever that vendor is, if they have a wound vac and a CPAP, they'll both get emails when either they get taken out of the system because they got discharged or they went to the hospital. This way, no equipment is just left hanging around. Also, once we're here, if a bed or a room needs maintenance or needs to get cleaned, here we'll have a mobile app or text notification that could go to your maintenance director and let him know that room 101B, the bed is not functioning, or the AC is not working, or just general maintenance. Here, when it's cleaning, it will give your housekeeping director, let him know room needs to be cleaned and what bed it is, and you'll be able to put obviously more specific requirements in there. We're going to go now to the binders. So when we put Hillary Clinton on a bed hold, so it automatically comes here. This is for the states that require bed holds, and you'll be able to view your bed hold. Exactly, this is the form that we have, but it's customizable. If you guys want to use a different form or you want different verbiage, this is all customizable. We'll give you the admissions director, and this is your bed hold. Also here we have the grievance forms. So if we go back to dashboard and we go to bed management, if we go to, let's say, we'll just stick with Hillary Clinton, why not? And we go down here, we can add a grievance. And this is just a template that we have. So person reporting the problem, it could be the patient's name, the department that it pertains to, what the complaint is, the department that needs to take care of that complaint, what we did to rectify that complaint, and then staff signature, so the date, name, and title, and then we save the grievance. So we can just type it. We don't have to actually type in anything here. We just save the grievance, and now it will show up by binders in the grievance forms. You'll see Hillary Clinton had a grievance, and it's here. Then for the admissions documents, this is to sign the admission agreement online. You'll be able to email it like the email back here. You'll be able to email it to the family member or to the patient and have them sign it. This way, you make sure that the admission agreements are signed. Here we have the emergency contact email. We have the patient's email. So this is a quick overview. The software does a lot more than just that. There's also a couple different little quirks that you can do. If you don't want this whole big view, you could compact it so it looks more like this. But I'm trying to keep it under 10 minutes. So just quick before you end, on the side here, we'll also have two tabs that say maintenance and housekeeping, which will be able to keep track of all your environmental inspections, whether it's your sprinkler systems, your smoke detectors, what you have to, when you have to get it done. So we'll have it all in here, reminding you that, hey, this month you have to get your smoke detectors inspected, your sprinkler system inspected, as well as your weekly generator tests. This will be able to keep track of all that stuff, as well as for housekeeping. When you have to turn over rooms, when you're doing full carbs of rooms, it will give you a real housekeeping schedule. So this way, everybody knows what's happening, which rooms are getting done. It just keeps it much easier all in the system. So that's just a quick overview, and that's the Bed Tracker software.